Hello, everyone. Okay. So welcome to the Block 3 workshops for today's event. So this session will be addressing marginalized and mainstream history of medicine and madness. So my name is Sara de Salle, and I recently graduated from the University of Ottawa's experimental psychology program. And I had the pleasure of working with Dr. Monica Williams at the University of Ottawa on projects related to research abuses and ensuring inclusion in modern psychedelic research. So this is a topic that is very close to my heart. In this workshop specifically, we'll have Canadian historian Dr. Erika Dyck and PhD student Dana Strauss, who is working in Dr. Monica Williams' lab. They'll share their expertise on the lesser known history of psychedelics, especially focused on marginalized groups. In this workshop, we'll present an overview of psychedelic history in Canada and globally from different perspectives, as well as discuss the issues of equity, diversity, and inclusion in psychedelic research then and now. So to start, I'll ask if our attendees want to introduce themselves via the chat function, either in Zoom or the Whova platform, if you feel comfortable. If you have any questions, you can ask them using the Q&A section of the Whova platform for this session. I'll keep an eye on that and direct the questions to the appropriate speakers. So to get started, we will begin with Dr. Erika Dyck. She is a professor and Canada Research Chair in the History of Health and Social Justice at the University of Saskatchewan. She's the author and co-author of several books, including Psychedelic Psychiatry, A Culture's Catalyst, Historical Encounters with Peyote and the Native American Church in Canada, Psychedelic Prophets, The Letters of Aldous Huxley and Humphrey Osmond, and co-author of The Acid Room, Psychedelic Trials and Tribulations of Hollywood Hospital, published just this year. She is also the guest editor of the Chacruna series on women in the history of psychedelic plant medicines. So welcome, Erika. I'll let you get started.
Thank you. I'm going to share my screen and hopefully this will work. Sorry, give me 1 second. Yeah, thanks so much for inviting me to be here. I'm really excited for this conversation, and I'm really excited to hear Dana's presentation and to engage in any questions afterwards. I'm going to try to do a really brief, so it will necessarily be not comprehensive. And I'm going to do a quick kind of a tour de force overview of this, which is going to miss a lot of things, but I really want to highlight, why I think that looking at the history of psychedelics is really important especially for outlining where those stories of marginalization and where equity issues are actually embedded in the way that we come to know psychedelics historically and how those themes have carried forward. So I've been working on this topic for over 20 years now. I keep having to update this. I keep getting older, weirdly. And it seems like it's been a little over 20 years now that I've been studying the history of psychedelics. And the stories have really changed, I think, about how we understand psychedelics, what's being written about them, and who's being featured or identified as real kind of pioneers or major players within this history. And I think one of the ways that I want to contribute to this is to go back into those histories and think about ways that equity and diversity have been sort of papered over in some cases. So I'm going to suggest, perhaps provocatively, that maybe we need new histories if we want to chart a more inclusive future. So there's a variety of different ways that historians and anthropologists and journalists and bloggers even have created or crafted different narratives suggesting, what is the kind of history of psychedelics? Do we start in the lab with the introduction of things like LSD? Do we look at the introduction of the word psychedelic? These kind of position us in the 1950s. And of course, we know that there are longer histories associated with Indigenous practices, some of which don't really associate clearly with psychedelics, but do engage with plants that we think of as psychedelic now, or non-altered states of consciousness that we might think of as being part of a broader history of psychedelics that could be really nourishing in this moment. So I'm going to give a couple of quick snapshots of ways that historians and scholars have been trying to identify these origin points. And these are maps that I had created. I don't know how to make maps, but I know how to find data. And so a really cool cartographer worked with me to help put these maps together. And what these represent are the stories of published articles. I shouldn't say stories, the evidence that we can find through PubMed if we look at the history of particular keywords here and the places where those labs mostly were anchored. And what I hope this readily represents is that there are gaps. Even if we use PubMed as our kind of entry point into the research on this historically, there are all sorts of gaps in the stories that get represented here. You can see this with here peyote mushrooms and ayahuasca, and here's another one for LSD, ketamine, and MDMA. There are some cool, perhaps anticipated hotspots on here, and there may be some research units that are less known, but it kind of distorts our understanding if that was our source of evidence, our only source of evidence, I should say. We also know that if we look back to ethnobotanical, archaeological, ethnographic research, there are a whole variety of other claims about origin stories. You can go back as far as ancient Egypt to see the honoring of mushrooms, also in a really sort of coveted and protected way, where mushrooms weren't even spoken about, and yet they're depicted in archaeological evidence. We recognize this in a long history of herbology and herbalism in China that recognizes cannabis as a mind-altering substance, and it mixes with other kinds of ideas about non-altered states and the power to gain insight from those states, and also who gets to gain power from those states. Of course, there's a long and storied history of psychoactive substances in Mexico, one of which is depicted on the bottom here. And then the last image there, the bottom right on the screen, is actually an image from the Middle Ages of poisoning from ergot. All of these stories sort of compete for our attention sometimes, I think, when we imagine, like, how do we understand this global framing and whether psychedelics were considered something that was coveted and honored, whether they were something that was woven into a larger set of plant history, or something to be feared as a poison or a toxin. There are a couple of key stories that move our understanding of psychedelics into the 20th century. And I really sort of concentrate this on particular interactions. Maria Sabina and her interaction with the Wassons, which Monica Williams has written about as well, is one of those stories. So this is a 1957 publication in Life magazine. So of course, it comes into American living rooms en masse and introduces the Anglosphere to psilocybin mushrooms in really unprecedented ways through this magazine article. And what it tells and what it reinforces is this encounter between a white man, Gordon Wasson, and a Mazatec woman, Maria Sabina. And so it's this interesting encounter that gets kind of moved into the 1950s, shaping that story. Now, as scholars have since showed us, there's of course more to the story. Gordon Wasson's wife, Valentina Pavlovna, for example, wasn't present in this meeting, but she had a PhD in mycology and was the one who interested Robert Gordon Wasson in this in the first place. Maria Sabina has also a really sort of tragic story as a kind of emblematic sacrifice of delivering these mushrooms to Wasson, but actually being shunned by her community over the long haul. And I won't get into all the details there, but simply to say that just sort of broadening back from what we can find in the readily available evidence suggests that there's much more nuance to these stories that might challenge us in thinking about whose voices have been written out of this history and what does that mean going forward. Another example would be to look at Albert Hofmann, which a number of people have done. He's, of course, the father of LSD, D-lysergic acid diethylamide. And interestingly, his initial interest in this area did not come necessarily from hallucinogenic substances, but from an interest in pharmaceutical demand for gynecological medicine. And this is what led him to ergot, which had been used in the Middle Ages by midwives and women who were sometimes described as witches or practicing forms of witchcraft, of course, in their efforts to control fertility. Of course, I'm using historical language specifically, and my sarcasm will be hard to contain if I continue. But the idea here that I want to present to you is that there are sort of these ancient trappings or older trappings of knowledge that then get rediscovered and associated with particular characters in this history that I think distort some of the richness and complexity. The story of psychedelics also comes to Saskatchewan and to Canada, and Saskatchewan in particular. And these are images from a graphic novel that depicts part of this history where in 1944, after Saskatchewan elected what was called then the first socialist government in North America, they embarked on massive healthcare reforms, introducing what we have today as Medicare, but the first form of publicly funded healthcare in Canada. And as part of those healthcare reforms, the then Premier and Health Minister, same guy, Tommy Douglas, hired a number of researchers, including Humphrey Osmond, who came to be the superintendent of the major mental hospital in the area at Weyburn, and he's the guy who coins the word psychedelic. So he brings with him this cluster of ideas, but also he begins to attract a number of people to the province as they engage in a variety of different research explorations using hallucinogens and then later what they call psychedelics. And what I wanted to emphasize here is the way in which their research with psychedelics was very much part of a set of healthcare reforms. They had direct policy implications embedded into the outset of that research. Here are a couple of examples. So Maclean's magazine, I mentioned the Life magazine in the United States was published in 1957. In 1953, so even a few years earlier, Canadian English, at least readers, gained access to some of this information about what we'll call hallucinogens at this point, because the word wasn't coined yet. In a 12-page article that made it into Maclean's magazine, which is fairly popular now, but even more so in the past, readers were introduced to a variety of experiments that were unfolding on the Canadian prairies, one of which was the use of psychedelics, in this case mescaline, as a model psychosis, a way to understand, appreciate, even empathize with patients experiencing psychotic disorders. So patients who experienced hallucinations and delusions, even though the experience didn't exactly mirror it, they felt that this was a really useful training tool and a really useful tool for cultivating empathy. The other piece of research focused on using psychedelics to treat alcoholism. We might broaden that to addiction today, but in the past, at least in this moment, it was really focused on problem drinking. Much of it was associated with male problem drinking. And I can talk about that in the questions if you like. And quite quickly, this research attracted people outside of the clinical context or beyond a kind of scientific veneer. People like Aldous Huxley, who was already a famous author at this time, living in Los Angeles, and he invited Humphrey Osmond to come and visit him in Los Angeles, and their friendship that led to the coining of the word psychedelic and the introduction of Huxley's book, The Doors of Perception, which was one of the first guidebooks that they used in an attempt to orient people to the kinds of effects that one might anticipate before they go through a psychedelic trial. Just for fun, these are their letters where they come up with the word psychedelic. If you look down to the bottom on the left-hand side, you can see what Huxley's written there: to make this trivial world sublime, take 0.5 gram of phenerethyme. And Osmond responds both in that letter and then in the one he writes back: to fathom hell or go angelic, just take a pinch of psychedelic. Of course, it's a year before this is published in scientific language, which enters it into the English lexicon, but these are their original letters. One of the stories that has been often written out of this really, I think, fruitful encounter and really interesting encounter between these two British guys in Canada and the United States is the ways in which they started paying attention to Indigenous ceremonies. Osmond participated in a number of Native American church ceremonies, and Huxley too participated in a number of ceremonies, not all to do with the Native American church, as they tried to probe ideas of consciousness and even elements of cosmology. And I would say the language they use is more, they're more curious about colonialism. And I'm trying to use my words carefully here. I don't want to romanticize this and say they're, critics that are kind of woke in a 21st century context in the way we might think, but they were very curious and wanted to incorporate some of these elements into the work that they were doing. And we see evidence of that partially depicted in some of the publications and some of their early protocols as they start thinking about setting. Beyond that kind of pharmacological reaction, they're really interested in the environment. I told you this is going to be a tour quickly over a bunch of things, so I'm going to keep zooming forward. Their work with alcoholism, their interventions using psychedelics, LSD and mescaline primarily, and later psilocybin, got really great results, really sort of outlandish results, unprecedented results, 70% cures here. There are other papers, I didn't find them for this presentation, but one model found 90% cure rates based on 2-year follow-ups. Many of those they attributed to learning group therapy techniques from the Native American church as they optimized some of those outcomes. But beyond the sort of momentum that was building around psychedelics, I'm using the Canadian example, but this of course was happening in other places too, was by the early 1960s, there were a number of challenges to this better living through chemistry, or this idea of investing in psychopharmacology and chemistry more broadly to solve the problems of modern living. And these are a few examples. There's Rachel Carson's Silent Spring, the thalidomide disaster. There are also the hearings about the birth control pill and all the disastrous side effects that it was causing. And at this moment, the Canadian government, in tandem with other governments, including the FDA in the United States, began to question whether or not psychedelics were being effectively tested and whether they too should be put on a schedule that had more oversight. They're sort of singled out with thalidomide at this moment, at least in the Canadian context. The same time that regulators and scientists and researchers, clinical researchers, are beginning to sort of question some of the methods that are being used to evaluate sort of safety profiles of psychedelics, there's a clear move to underground distribution of psychedelics and the production of quantities, acid and a whole variety of other things that are called psychedelic, but sort of deviate from Sandoz-approved psychedelics. They move underground, and we know that they're being distributed in concerts and a whole variety of places. These are just some examples from the early blotter days. Also around the same time that the first underground acid is identified by authorities, this Harvard psychology professor, Timothy Leary, loses his job for what's described as unethical experiments with psilocybin. And it's also known that he was sleeping with one of his graduate students and not showing up to class. So there are a variety of reasons that Harvard may have wanted to move him out of that position. And regardless of what the final straw was for the administrators, Leary doesn't go away quietly. He kind of catapults into the public spotlight and becomes this media darling and a real sort of magnet for stories about psychedelics, where he moves away from whatever kind of scientific checks and balances are in place and suggests that he's part of starting or triggering a countercultural revolution with psychedelics at the helm. By this point, by the mid and certainly by the late 1960s, the public health response, the messaging from public health officials, whether that's from the NIH in the United States or the Health Canada here in Canada, really shift the story away from any positive aspects of psychedelics towards this really sort of just say no or really me in Canada, all of these sort of negative drug taking components. The suggestion that LSD will cause insanity is the answer to that question mark in this film. And regulators, politicians sort of join forces declaring, kind of putting forward a prohibition on psychedelics along with other drugs. Of course, this is the ushering in of the war on drugs, not pharmaceuticals, but drugs like marijuana, heroin, psychedelics for sure. I'm just kind of skipping through some of this stuff here because I want to end by suggesting that depending on how we want to sort of reinforce some of these narratives of the past, I think there are opportunities to look at some of those marginalized encounters or those encounters that haven't had as much spotlight on them, such as the ones with the Native American Church as one example. But certainly if we take a more global lens, there are many, many opportunities to examine how marginalized communities have been downplayed, and sometimes for good reason, to protect the sources and to protect this information from further recrimination. But here, as we enter into what is being described as a psychedelic renaissance, maybe we have an opportunity to do more than change the regulatory profile of pharmaceuticals, more than move them into the pharmaceutical marketplace, but to really think deeply about some of those longer threads, I would say, of historical injustice that have played out in this past. So thinking about supplies, whether that means the overharvesting or psychedelic tourism, particularly on Indigenous lands. We know this is the case certainly in Mexico, but also along the Pacific Northwest. To think about how Indigenous healing practices were first coveted and even sometimes to a small degree, I would say, integrated into early projects or early protocols. And to think about what that means if we were actually to pay closer attention to Indigenous cosmologies as we begin to think through how these apply to trauma-based healing, end-of-life distress, anxiety, even challenging some of those definitions themselves. And I question too whether this history helps us to appreciate where there's kind of a split forming between, I'll suggest that there's a split forming between the production of scientific academic knowledge, even publicly funded scientific academic knowledge, and the gatekeeping that goes on in that place, as compared with what's going on in the underground, which is an amassing of other forms of expertise, other forms of social capital that help people to assess risks and to make good decisions or to develop trust in another kind of marketplace. I think that there's some tension forming between these two different ways of amassing psychedelic information. Thanks, and sorry, I hope that wasn't too long.
Thank you. All right, so thank you so much, Erika, again for a wonderful presentation. Our next speaker is Dana Strauss. So Dana is a white Canadian Jewish doctoral student in clinical psychology, whose research interests revolve around social justice, racial equity, and the intersection of mental health, race, culture, and psychedelics. She believes there needs to be increased inclusion of Black, Indigenous, and people of color in the psychological and psychedelic sciences, and that white people share the responsibility to advocate for racial equity and inclusion. She has co-authored several research papers, including research abuses against people of color and other vulnerable groups in early psychedelic research, of which I was also a part, so I can highly recommend this. And she is the founding member and chair for the Association for Behavioral and Cognitive Therapies Psychedelic Research and Therapy Special Interest Group. I'll invite Dana to tell us about her work.
Thank you, Sara. I'm just going to share my screen. Okay. So thank you. Yes, today I will be talking about research abuses against people of color in early psychedelic research in the United States. And shout out to Sara, who she mentioned also authored the paper. And before I start, I just want to warn you that I will be discussing sensitive topics related to racial trauma, abuse, substance use, and some descriptions of abuse will also be graphic. So please do what you need to do to take care of yourselves. I'll just start by briefly discussing the history of psychedelics, although I'll probably skip over some things because Dr. Dyck really covered a lot. And then I'll describe our study and our findings, and then where we go from there. I just want to start by acknowledging that the land I'm speaking to you from is the traditional unceded territory of the Algonquin people, and Indigenous peoples, as Dr. Dyck mentioned, around the world have and continued to steward not only the land we live on, but also the psychedelic medicines that we cherish today. So I was going to talk a little bit about the history of psychedelic use and plant medicine use in Indigenous cultures all over the world, but I think Dr. Dyck talked about this, so I'll move on and talk about what happened when they were introduced into Western culture in relation to sort of kind of talking about the study and how this study came about. So after they were introduced into Western culture over the next few decades in what is now called the first wave of psychedelic research, LSD, along with other classic psychedelics, psilocybin, mescaline, and DMT, were investigated in the study of mental health, substance use, and psychotic disorders such as schizophrenia until the Controlled Substances Act of 1970 effectively halted psychedelic research. However, it wasn't until 5 years after the end of this first wave of psychedelic research that news of the use of LSD in CIA-sponsored research emerged, and stemming from fears that LSD could be used as a form of biochemical warfare during the Cold War, and that the Soviets had already developed their own mind control techniques. The CIA Operation MK-Ultra focused on the use of LSD for mind control, brainwashing, and as a truth serum for interrogating spies. Over 80 public and private research institutions, including many universities, hospitals, and prisons, were provided with funds knowingly or unknowingly through the MK-Ultra program and conducted experimental research with LSD on civilians, prisoners, and patients. So our study came about in an interesting way. After hearing rumors and having a lot of difficulty engaging local community members and therapists for an MDMA conference in Louisville, Kentucky, our team and Dr. Williams decided to dig a little deeper. So what we did, I seem to have lost my mouse. There we go. We examined 48 research articles that were published during the 1950s to 70s and that administered psychedelics, including LSD, DMT, mescaline, psilocybin, and THC. We examined the ethno-racial composition of the participants for each study, the recruitment strategy used, study methodology, and the safety across the studies. We also conducted a thematic analysis to uncover recurring issues surrounding safety and ethics throughout the studies. We found that across all of the studies, there were recurring issues surrounding use of incarcerated populations, coercive incentives, problematic dosing, questionable scientific merit, and set and setting. And this table shows the percentage of studies with each ethical violation. You can see that half of the studies used prisoners, close to 40% used doses that would be considered unsafe today, close to half administered drugs too frequently, and more than half were coercive, and more than 60% were non-consensual. So in short, the CIA was interested in a mind control drug, and to find it, they exploited and abused incarcerated, primarily Black men. The researchers conducted brutal experiments in which they coerced their victims into taking extremely high, frequent, and chronic doses of psychedelics, often without their knowledge or consent. Many of the studies did not report the race or ethnicity of the participants, but we looked at the sites where the studies took place and where participants were recruited, and we saw that people of color, predominantly Black men, were significantly overrepresented. The bulk of these studies took place at the Addiction Research Center in Lexington, Kentucky, now known as NIDA, the National Institute on Drug Abuse. This was a prison built for doing research on inmates. And as you can see, Black inmates were almost 10 times overrepresented. Even worse, the prisoners at ARC were offered heroin in exchange for participating in the studies. This was unquestionably unethical, but it was also particularly coercive and exploitative, considering that prisoners at ARC were often there for drug-related offenses, and so researchers might have been giving heroin to prisoners who might have also been struggling with substance use disorders. Some of the studies that did report the participants' race also reported treating the participants of color worse than the white participants. And this is where it starts to get a little bit sensitive material. So, for example, despite knowledge of the importance of set and setting in experiences with psychedelics, in one study, the researchers reported that the white participants who were living freely at the time were given LSD in the researcher's home under conditions designed to reduce anxiety, whereas the participants of color who were prisoners were given LSD in a prison ward in which comfort or anxiety were not considerations. In another study, Black participants were given more than double the dose of LSD compared to white participants, and white participants endured 8 days of LSD administration, while Black participants endured chronic LSD administration for up to 85 days. In many cases, the inmates didn't even know what they had been given, and one inmate who was essentially being tortured asked to leave many times and was forced to stay. On the next couple slides, I've included some excerpts from the research articles that were produced from these experiments. So in this study, a chronically ill Black participant was described to be of low intelligence with only 2 years of education and an impoverished socioeconomic background. The researchers then described him as if he were an animal. They reported he had a wild, frightened look, and he became quiet and no longer required restraints, which had been necessary during the previous experiment with LSD. In another experiment with respect to one of the incarcerated Black participants, the researchers reported, after recovery from this severe reaction, the patient wished to drop out of the experiment, but after considerable persuasion, agreed to continue. He was started on 50 micrograms of LSD once daily, and this dose was increased until he again received 180 micrograms of LSD on the 22nd day. In an interview, Edward M. Flowers, the only surviving prisoner research participant to have been located from these experiments, reflected on his participation in LSD experiments at ARC, the Addiction Research Center, now known as NIDA, And he said, "They used my ass and took advantage of me." So where do we go from here? There have been many calls for action for researchers to conduct culturally inclusive and socially responsible research. Inclusion does not simply mean having a diverse sample of research participants, although this is important, but more importantly, treating participants based on the principles outlined in the Belmont Report, namely exhibiting beneficence, justice, and respect for persons. Inclusive research must also involve representation of Black, Indigenous, and people of color in participant pools, on research teams, as principal investigators, journal editors, and editorial and association board members. The exclusion of Black, Indigenous, and people of color from legitimate and potentially beneficial psychedelic research is an ethical concern above all else. And a further implication is that these treatments produced by the research might not generalize to or be safe or effective for a culturally and racially diverse population. Also, psychedelic researchers and clinicians today put a great deal of thought and effort into creating a comfortable setting, such as using a couch or bed, eye shades, relaxing music, etc. And attempts at removing the sterility from clinical trials and therapy rooms are a good start, but people of color have a strong cultural memory of research abuses perpetrated against them by white Western researchers. And this has resulted in a deep cultural mistrust of Western research and a stigmatization of research participation within communities of color. And so, and also in addition to the trauma of participating in this research, is the fact that Black and Indigenous people in particular are disproportionately targeted by police, arrested, and incarcerated under the so-called war on drugs. So all this to say that additional considerations are needed for participants and clients of color. So what does culturally responsive research and therapy look like? First and foremost, as I've mentioned, research and clinical teams should be diverse. Due to racism, people of color often feel less safe and able to be open and transparent with white researchers and clinicians. So some ways to ensure people of color feel safer and more comfortable might be to offer ethno-racial matching of therapists and participants to create a culturally informed setting, and as well to prevent further harm to people of color. All therapists should undergo anti-racism and cultural competency training. And I included Dr. Monica Williams' book there as a good place to start. So as you can see, there's an urgent need for greater racial and ethnic inclusion in psychedelic research. Researchers need to prioritize ethno-racial diversity in their participants as well as in their teams. We also need to prioritize inclusion across other dimensions as well, including, as I mentioned, the research and therapy setting, but also the focus of the research itself. So for example, treatments for racial stress and trauma and clinicians competent in providing these treatments are urgently needed, but these treatments are understudied and clinicians are undertrained. And this is where journals, associations, and organizations that sponsor clinical research trials and train clinicians have an important role to play in terms of prioritizing ethnically and racially inclusive participants, teams, topics, and training. So in closing, the academic community has failed communities of color, particularly Black and Indigenous communities, by conducting horribly unethical and inhumane experiments on these people. Although these abuses cannot be undone, it's the responsibility of current researchers to address and rectify these injustices, such as by recognizing the contributions and honoring demands of the impacted communities, conducting ethical, culturally inclusive, and responsive research, and improving access and quality of mental health care for communities of color. I've just included, there's some papers here to learn more about psychedelics and social justice. And then this is the book I had mentioned earlier. It's a great resource for clinicians and really anyone who wants to know more about microaggressions and how to recover from them. And this is also a good resource for mental health practitioners, and it emphasizes working with people of color from a contextual behavioral science framework. And then a little plug. Thank you.
That's great. Thank you, Dana.
Thank you so much. And I'll stop the recording now. We can do that.